Hi there, good evening. If it's evening where you are, we're going to get started in just a minute, so just bear with me. I'm going to get my screen shared here. Throughout this meeting, if you are watching live, feel free to use the chat box or the question and answer box for anything that you would like to ask. I'll do my best to monitor them at least every few minutes, so if I don't get to your question right away, I will be checking it throughout. But at the end, I will definitely answer all questions that are there. If you're watching this when it's recorded, my contact information will be available at the end of the presentation, so you can feel free to reach out directly to me with any questions. They won't be shared with the group, but just personally, feel free to do that. Okay. So I'm going to get started right here. Want to be respectful of everyone's time, so if anybody's joining late, no big deal, but if we're ready to get started, then I want to get started here. Again, if you have any questions, feel free to use the chat box or the question and answer function to ask those, and I will check it. I'll be checking it on and off, and at the end, I'll definitely be sure to answer any questions. So what we're going to be talking about this evening, obviously why you're here, is talking about resistance training for the hypermobile athlete. So I would say that if you have a body, you are an athlete. Some people get a little bit concerned about the word athlete, and sometimes if you're having some issues with hypermobility, with pain, with body awareness, with progressing your workouts, anything like that, it can be easy not to feel like an athlete. But I would say if you have a body, you are an athlete. We're all moving in some capacity. I would imagine most people that are interested in this webinar are not somebody who is just completely bedbound, something like that. The focus of this webinar will be on people who can do some basic movement patterns pain-free. I can definitely put together something else for people that are at a lower level that are still struggling with a ton of pain, but it's hard to fit all that in the scope of one webinar. So this is going to focus more on strength training on somebody who has their body somewhat under control and is just looking to add some strength. So I want to introduce myself a little bit, excuse me, a little bit first, just by introducing myself. Some of you guys know me. I do know some people in my circle, some of my clients are signed up for this webinar, but the majority of you guys I do not know. So my name is Sarah Wynn Faruza. I graduated from SUNY Cortland with exercise science degree, concentration in kinesiology, and a minors in biology and chemistry in 2012. I then went on to attend Sacred Heart University and received my doctorate in physical therapy in 2015, became a certified strength and conditioning specialist in 2016. And I live in Fairfield, New Jersey with my husband and my puppy April. And there's a picture of her during when the pandemic was in full swing and I had closed down my office. I was doing virtual treatments from home, and she just loved the little area that I had created. So she hung out there a lot. So the reason I'm telling you my background here is just to give you an idea where I'm coming from. It can be really tough in the medical space. There's a lot of different people trying to give information, and I believe that most people are truly doing it with good intention, giving you the best information that they have. But it is very important to vet your sources, and that's not to say that somebody who has a higher degree is automatically smarter and more experienced than somebody else. Sometimes patients, teach me more than any of my doctoral professors ever could, but it is just important to vet where you're getting your information from and make sure if somebody's giving you some advice that it makes sense for you and it's not just something that worked for them, but that has been researched and is backed for you personally. So what do I do? This is just, again, a little bit of background information to tell you where I'm coming from. And so in 2016, shortly after graduating physical therapy school, I moved from New York to Texas for a job working with gymnasts. I was a gymnast my whole life, and I kind of stepped away from that world, started my physical therapy career, and then got right back into it. And interestingly enough, the woman who I was working for down there happened to specialize in treating patients with Ehlers-Danlos syndrome. At the time, when I heard about it, I thought maybe I remembered reading something about that in a textbook in school, but I couldn't tell you what it was, what it entailed. But the first patient that I saw, that I viewed her treat with this, had a very, very, very severe case. And I just became really interested in it. And together we worked through treating hundreds of patients during my time down there. She taught me a lot about her approach, and I kind of mixed that with my approach for something that I feel really comfortable with and feel like helps out quite a bit. And while I was doing this, I started seeing the mobility spectrum more clearly. So in 2016 to 2019, I became a traveling physical therapist. I moved around the country, seeing a bunch of different things, and I started realizing how treatments and strength training really flip-flop on each side of the mobility spectrum. So when we're dealing with somebody that's hypermobile, which is generally a smaller percentage of the population than somebody who is hypomobile or stiff, we really need to flip-flop our approach to how we're doing that with both physical therapy side and the strength training side. It is somewhat backwards, so that's where it can get a little bit confusing. And I see a lot of clients who have tried different strength training programs, physical therapy programs, things like that, and it actually made them worse. And I think it's because a lot of them are created for the large segment of the population who is more stiff. And then when we get on this other side, we really need to flip things around. So in October 2019, I opened my own clinic in Fairfield, New Jersey, where I do physical therapy and performance training for athletes, and I specialize in gymnasts and others with hypermobility. Most gymnasts do have some degree of hypermobility, not all, but quite a few of them do. So this webinar in particular, last year, when everything kind of shut down with COVID, I shut down my clinic. I really focused on providing as much information as I could. And I had made a commitment to myself to do a webinar per month, focusing on different aspects, different populations of people that I treat. Unfortunately, I have to admit that I did fall off that wagon a little bit. Things opened up. I wanted to get back in the clinic, get back to serving my people. I didn't want to be on Zoom after me and everybody else had spent many months on Zoom. So I did fall off of that a little bit, but I am renewing my commitment to do that. So this is part of that series. This is purely informational. No specific medical advice will be given. Obviously, everybody viewing this, I don't know you personally. I don't know your condition. So it's important that you take this information and vet it, just like all information. If you do want to reach out with specific questions to you, we can talk about that a little bit, but this is just kind of general information. So I want to start off with saying what are the greatest impairments I see with hypermobile populations that prevent them from resistance training, prevent them from strength training, make it difficult, make it painful, all of the above here. So there's a few main things that I'm going to address. The first one is proprioception. So that's going to be perception or awareness of the position and movement of the body. And this occurs through sensory receptors in the skin, the joints, and the muscles. People with Ehlers-Danlos syndrome definitely have a decrease in these sensory receptors. In the hypermobile population, that's kind of a wide spectrum, so it's still up for debate. However, a lot of times if I'm working with somebody or I see somebody with hypermobility, they'll be doing an exercise, but all of a sudden one of their feet is facing backwards the other way, that it's not supposed to be, and that can really hinder progression and cause some pain in areas where you feel like, okay, I was working out my shoulders, but today my hips and knees are super sore, and why is that? And a lot of times that's because there's not a lot of attention paid to the rest of the body. And somebody who's normal on the mobility spectrum, I don't really like that word, but we'll use it for right now, has some idea of where the rest of their body is without looking. People who have hypermobility, I've found, have a very poor idea of where the rest of their body is without looking. So they have to really kind of call attention to each area of their body and plan their workouts in a way that forces this. So proprioception, that's the first big problem. The second one, we want to talk about the stability continuum a little bit. So when we look at joint stability, we have kind of 3 layers to that. The first layer is the joint and the joint capsule, and that's made of collagen. And if you do have Ehlers-Danlos syndrome, you know that collagen, you're producing faulty collagen. So this is not going to work too well. If you have like a hypermobility spectrum disorder or a single joint hypermobility issue, it may not be your production of faulty collagen, but just that the collagen has been stretched out beyond repair in that joint. So that first layer of stability, we're going to say that's pretty much gone. And I wouldn't say it's gone. There can still be some level of stability there, but it's not doing its job. And if you are truly hypermobile, it's going to be very difficult to increase the capacity of that at all. But that doesn't mean that we're just out of luck there. There's definitely 2 other layers that we can rely on and need to rely on. So the second layer is some of our smaller stabilizing muscles. These are meant to be slower twitch muscles that are kind of on all the time. So whenever we're moving, these muscles are slightly active and they are stabilizing our joints. So this is going to be the biggest key in somebody with hypermobility to be able to resistance train. And then the third layer is our prime mover muscles. So those are our large muscles that are meant to kind of contract and relax as we go through movements. And something that I see a lot is that the prime mover, the stabilizing muscles are not strong enough. So those prime mover muscles are taking over and they're causing a ton of fatigue and they're causing joints to not be very stable because those larger muscles, we can think of them kind of like a big heavy machine where they'll get the job done, but it's not going to be very precise. So it's not going to correctly stabilize joints. They may be able to stop dislocations and even subluxations from happening. But we want those joints to be as centered and as stable as possible. So that's where the biggest difference in people who are hypermobile can make is to improve the function of those stabilizing muscles, which improves the joint stability, and it allows the prime mover muscles to do their job, which if we're strength training is to lift up the weight, things like that. And actually improve strength long term. So then long term, those 2 areas can work together a little bit better, but those stabilizer muscles have to get kind of up to speed with that. So the last impairment is communication. So with this, I want to talk about if we're preparing to lift up a weight. I'm going to use the deadlift as an example. That's kind of my favorite lift where we're just lifting a weight up off the ground. Reason it's one of my favorites is because it's applicable both if you're trying to strength train, that's going to be one of the biggest bang for your buck exercises. And if you're not trying to strength train or you're just trying to function, most people do many deadlifts every day without realizing it. If you bend down, pick up a bag of groceries, that's a deadlift. Even if you bend down and pick up a pen or a golf ball or anything like that, that is a version of a deadlift. So it's something important that we do. If you bend down and pull up your pants, that's a deadlift. So we need to be able to be doing that correctly no matter what level we're at. So what we should be doing before we do a deadlift is we're going to mentally prepare to do the lift. We're going to see what we're going to do. We're going to get into position. We're going to stabilize the proximal muscles. So I'm going to say for most lifts, that's going to be between the hips and the shoulders. That could vary depending on exactly what you're doing, but we'll call that the proximal muscles. So we're going to stabilize that area and then initiate the lift. So in the hypermobile population that I see and that I work with, they have a really tough time stabilizing those proximal muscles, or they just don't do it at all. They skip over that step. They go to initiate the lift. So what happens then? If we're doing a deadlift, holding the bar in our hands, if I don't stabilize for my shoulders and for my core, I'm basically lifting that off the ground with my hands and my arms. Those are much smaller muscles than my shoulders, my hips, my glutes, my abs. So I'm going to be very fatigued. I'm not going to be able to lift a ton of weight, and I may even get some injuries higher up. An interesting story about how I really realized this. There's not a ton of research on this stuff at all. I believe I've read the full body of peer-reviewed research on this, which is not very much. But I was shaking hands with a client, and I just shook his hand. I put my other hand on his shoulder, as I typically do sometimes. Couldn't tell you why I do that. I just do. And I realized that I was shaking this gentleman's hand. His shoulder was not stabilizing in the least. And it's not something I'd ever thought about that I do before or that most people do. But the absence of that was very loud. I really felt that he was not. So then I kind of saw that and applied it to different things and realized that a lot of my hypermobile patients just don't stabilize with the larger muscles. Again, those larger, more central muscles are going to be able to take a lot of the weight, a lot of the stress, so that the smaller muscles only have to do their little bit. So that's something that we want to make sure to work on. So why is this different for me? Not necessarily for me, but for you. So if you're hypermobile, why are things different? Why can't I just go in and do the same workouts as my peers, possibly my family members, depending on if you have a genetic condition or not? What's different about it, and why do those other workouts cause me pain? So I want to talk about usual cases. And again, I hate using the word normal or usual, but we can all admit that most people are on the more hypermobile or central kind of normomobile spectrum. So typically, if I have somebody coming in, I do also work with plenty of people who are not hypermobile. And when they come in for a workout, we're going to do some mobility work first and then stability work. We're going to loosen everything up and then do our strength training. We are going to work through movement patterns, and then we're going to load those patterns. So we're going to get things down for sure with no weight, and then progress by adding a little bit of weight at a time. We might do some single joint movements and then kind of put it together. So we may work on a specific muscle group, another muscle group, and then put that together with a whole body or half body, then whole body type movement. And with these people, at the end of a movement, I want them to lock out. If we're doing a shoulder press, I want them to get overhead, joints locked out, and really finish the lift. Now, that seems probably all pretty normal to you, but what I've found is working with people who are hypermobile, we really need to flip the script on pretty much all of that. So when my hypermobile patients or clients come in for a workout, we're going to start with stability work. We may, some people do have some mobility work they still need to do, one area that needs a little bit of mobilization, potentially, or maybe more than one, but we're typically not going to do it before the stability work. We don't want to loosen somebody up too much when they already have too much range of motion. We want to work on stability and controlling that range of motion, and then we might flip that mobility stuff at the end if we need to do it at all. These people, we may need to load them early. So somebody who's hypermobile, you might need to actually use some weight to learn a movement pattern and then decrease the weight to be able to do it without. So we talked a little bit earlier about proprioception, and adding weight actually helps with proprioception, helps our bodies realize where they are in space. So I'm not talking about loading up hundreds of pounds on a bar and doing something, but we may need to hold a weight, hold an empty barbell, light kettlebell, light dumbbell, something like that, to help our body really feel the movement pattern before we can even do it without weight. And then we might need to reload after the fact. But I've found with some of my hypermobile clients, if we just start trying to learn a movement pattern without any weight, we might spend days, weeks, months working on getting all the joints to be doing what they're supposed to do. And then by the time we load, it's been so much time, where if we actually load early, then we can progress to without load and then reload and actually finish that whole process a little bit quicker. The other thing is that we are probably going to do compound movements before single joint movements. So we want everything to be talking to each other. We want the whole body to be moving together. And then we can focus on some single joint movements. So that's, again, the reverse. And then the last part of this is oftentimes, if you are hypermobile, you want to keep tension throughout the movement. So we'll go back to that same overhead press motion from before. So if we're coming from our shoulders and we're coming up, we don't necessarily want to lock out at the top of the lift. You can see I have a little bit of hypermobility in my elbows, very small compared to a lot of the population that I work with that actually get a true big angle in their elbows. And we certainly don't want that loaded. And we'll talk about that in a minute or two. But we want to keep tension throughout the whole time. We don't want to get to that bony end range where our joints are just sitting on each other. We want to keep some muscular tension throughout, and that's going to prevent some lifting injuries that could occur. So strength training has shown a significant decrease in pain and fear of movement for a hypermobile population. So this is really important. You guys who are interested in this webinar, thank you. You guys are doing your body good by working on this stuff. So like I said, there's very few studies on resistance training in a hypermobile population. So it can be tough to kind of put things together. A lot of this webinar is a combination of the research that is there and my personal experience. So this study, though, in 2014 showed that hypermobile people who performed some type of resistance training had increased muscle strength, decreased tendon elasticity, decreased pain, improved balance, and improved proprioception. So these are all good things. Again, just reinforcing why if you're here, you're interested in this, why you are headed down the right path. So why is motor control so important? This is about controlling lifts and not just kind of throwing the weight up and catching it on a bony end range, something like that. So athletes, we already said, if you have hypermobility, you typically are going to have poor proprioception. You don't know where your joints are in space. You have to control all of them at the same time. And going through that full range of motion actively, so with no weight, it's okay. Probably should not be loading to end range. And again, there are going to be exceptions to this. There's some very, very high level athletes who have been able to control themselves, able to load at end range and accomplish all kinds of great things. So I'm certainly not trying to limit anybody. But if you are a beginner intermediate lifter, you probably don't want to be lifting all the way to end range. So we can look at this lifter here on the platform and look at her shoulders, and she looks pretty sure of that end range position and pretty stable there. But for most people who are beginners or intermediates or have moderate to severe hypermobility, this position is going to be really, really compromising. So we may want to stop a little bit before that end range and understand where that is, especially once there's fatigue. These positions can be very dangerous. So if you're lifting, going through a full session, a full set, towards the end, the fatigue could be pretty tough. So we want to definitely be careful about that. So this is talking about the closed packed versus open packed position. So a closed packed position is the joint position in which there is maximal contact between articulating surfaces. So that's kind of the textbook definition of it. And I'm going to use the knee as an example. And by knee, I mean I'm going to use my two arms here as if this is my shin, this is my thigh bone, and my kneecap would sit right on here. So if the leg is straight at 180 degrees, these surfaces are contacting each other really well. That's a closed pack position in a normomobile population. So somebody who has full leg extension, they're not too stiff, but they don't have hyperextension. So that's really good. So we can straighten that leg, and now these surfaces are congruent with each other. I can put a lot of force through here, and there's going to be no problem. Bone pushing towards each other, we're good to go. In an open pack position, there's minimal contact between articulating surfaces. So that's why maybe loading in the mid-range of a squat, if we bend the knee this way, these surfaces are not articulating, not contacting each other too well. So if we load that and put a lot of pressure, that's a lot of pressure in a small joint surface. Now, if you're hypermobile, especially in the knees, for this example, you know you have some hyperextension. So now we're going the opposite way, but we're going to kind of get that same idea where those joint surfaces are not too congruent. So we want to be careful about loading in that position because the load is going to be a lot on a small surface of the joint rather than distributed evenly throughout. So I'm a very visual person, so I put some visual aids here to talk about open pack versus closed pack. We can see in this guy, he's not looking too good, but he is running, so that's pretty good. But his back leg here, his knee is in the closed packed position. It's stacked up pretty nicely. This front knee is in the open packed position. We see the joint surfaces are not too congruent. There's a lot of room for error here. Same thing in this hip right now is in the open packed position. If we put a lot of force through the knee and we don't have great hip stability, we can be in trouble. Compared to this hip in the back, it's hard to see, but it is sat right in that socket, super congruent. We can put a good amount of force through that. So when you're lifting, thinking about obtaining the closed pack position, not necessarily full extension or a locked out position, because the locked out may actually be past that closed pack position. is what we want to look at. So we can think this golf ball on the tee right here. Again, this is like the closed pack position. I could probably press down on this golf ball with a good amount of force, and provided that the tee didn't break and everything, the golf ball is going to stay right on the tee. Compared to this one, if we were to take that club away and I were to just put some force directly down on this golf ball, it's probably going to fall off the tee. So again, when you're working out, you want to make sure that the joints are congruent, especially if you're overloading, lifting heavy. Again, I don't think that that's a bad idea at all for the hypermobile population. I don't want to limit anybody. I do think that heavy lifting can be safe, but it just has to be done correctly. And if you do have hypermobility, you may need to pay more attention than some of your peers who do not, on really exactly how you're lifting, what you're doing, and how you're doing it. So when is loading indicated versus contraindicated? So if you're here, probably looking to load, but the two conditions that I use to really move on to loading is that range of motion is pain-free and able to identify the end range of the lift as opposed to your end range. So again, if you're hypermobile, you may be able to extend that elbow and it goes way past extension. And again, we don't want to be loading in that position. So being able to identify where you should stop before you load is super important, and being able to go through that range of motion on its own without pain is important. And again, scope of this webinar is for people who can pretty much meet these conditions for the most part. We can probably do another one coming up in the fall for a little bit lower level, people who are trying to meet these conditions, people who are striving to meet them. So now here's the meat and potatoes here is, what can I add to my program to improve joint stability? So if you're listening to this, you probably do perform some type of resistance training, and you may be including some of these things. If you're including all of them, you're doing great. Keep going. And if you want to talk more specifically about what else you can do, we can definitely do that on a case-by-case basis. But these things are pretty much never a bad idea, as long as these other conditions are met, that we can move through the ranges of motion without pain, and that we can identify the end range. So we're going to talk about three different things here, three different methods. The first one is called reactive neuromuscular training, or RNT. The second one is unstable surface training. And the third one is varied angle isometrics, or VAI. So reactive neuromuscular training is basically feeding into the problem to force a solution. And the objective of this is to stimulate joint and muscle mechanoreceptors to encourage maximal afferent discharge to the appropriate CNS. And that's kind of science talk for basically we want our body to self-correct. So I'll show you some examples here which can really help. So this is something for somebody who has some hypermobile elbows or is trying not to hyperextend the elbows. We'll see, hopefully this video will play here. This band is actually forcing her to hyperextend, and she is fighting that by controlling it. So the band is feeding into the problem, it's feeding into the hyperextension and helping out the hyperextension in order to force a solution. This young lady would hyperextend a lot. She felt okay about it. But when the band was actually pulling her into hyperextension, she felt pretty unstable. So that forced her to want to create some stability and keep some stability throughout the range. And then how to demonstrate this on the knees as well. So this one is more so pulling the knees together rather than into hyperextension, but pulling them together. And it's forcing her to push out on them against the band to create that stability, create that solution, again, feeding into the problem to force a solution. So the second method here is unstable surface training, and there's a lot of controversy on this in the strength training world on if it's good or it's bad. Either way, I think it's helpful for the hypermobile population. It has been found to lead to improvements in proprioception, a decrease in muscle reflex time, and an increase in stabilizing muscle activity. So we do want to be careful and not be maximally squatting on an unstable surface or something like that. But here's just some basic examples. So in this first example, we're using the upper body, and this one, the gymnast I work with, and she is because the surface she's hanging on to is unstable, she's being forced to stabilize her shoulders. Otherwise, she wouldn't be able to lift herself up off the ground. If she didn't have good shoulder stability, she would run into some pain or blockage or problems there. But she's stabilizing pretty well. And then here, same thing for this young lady. This is kind of like a seesaw type deal. So she's kind of being forced to stabilize there, or else she can feel the plate hitting the ground. So it does help, like I said, to improve that proprioception, improve the joint centration, so the joint being in the center of the socket, depending on what joint we're talking about, and improves the stabilizing muscle activity as well, which if you remember back from here in these couple of slides, we wanted to improve stabilizing muscles as a big key in improving stability and allowing those prime mover muscles to do their job and not only be stabilizing. So the third method here is the varied angle isometrics. So this is, if you are familiar with strength training, you might understand isometrics as where we're just holding the joint in one position against some resistance. For most movements, there's going to be a typical angle where we do that. So for the bicep, it might be down by the side. We hold an isometric here. But this method actually involves doing it at different angles throughout the range. And this is beneficial for sporting activities as well as daily activities that require a certain joint angle. And this is one of the few things that has been studied, and it showed similar strength gains to a dynamic program, but improved proprioception and higher strength at these angles. So we'll see this young lady is doing it with a squat. So she's holding different areas throughout the range, and we can see how it's going to get her comfortable at these different positions. So eventually she can put it all together. And then also, if your sport or activity that you do requires you to be at a certain angle, you will get used to that. And here's upper body example. So she is holding this. Again, this is a gymnast, so she's required to hold her body still with her arms out in front of her at different heights, or go through that range up to down. So she's working on these isometrics, and this young lady actually had an injury, so she's just doing that with a PVC pipe, but definitely can load that a little bit and get comfortable holding at the different angles. So that will improve some strength throughout the range as well as at the specific angles. So how can I safely progress? So let's just say you can do these movements. You can add a little bit of weight, but you can't seem to get past a certain amount, or you're worried, you're nervous to add more weight because you're nervous that something will happen. So one of the biggest things that you need to do is make sure that the stabilizing muscles are active, and these three methods will help you to do that. And that allows your prime movers, your larger muscles, to actually focus on moving the weight. So I do find a lot of my clients, once we get over this kind of stability hump, all of a sudden weights that were so heavy or felt like a max lift before are now just kind of floating up. So what we need to remember again is that locking out true end range or end range at the end of a lift may not be safe. So we need to keep some tension throughout the lift. The other thing is that if you feel stuck at a certain weight, you can progress reps, sets, duration of the hold, especially with the isometrics, progress the stability requirements. So talking about the unstable surface training, you can increase the instability of that surface. And again, we're probably not trying to do maximal or heavy lifts at all on unstable surfaces, but just going through the motions, maybe a little bit of light loading to allow your body to regulate itself on those unstable surfaces can be definitely beneficial. So that's kind of the main focus of what I had for you guys this evening. I put some information on here for how you can get in contact with me or just follow me for some more content. My website, my email address, you can feel free to directly email me if it's a question I can answer for you. I'm happy to do so. My Instagram handle is there. I recently just joined the TikTok, and definitely putting out a bunch of hypermobility and EDS content on there. So feel free to follow me, check it out. I don't really dance or sing or anything like that, but just some informational videos for your viewing pleasure there, so you can check that out. You can also find me on the Ehlers Danlos directory if you're looking for some healthcare, anything like that. So again, this is an informational webinar, but if you do have particular questions for yourself that you want to talk about, or you want help designing a program for yourself, anything like that, I'm happy to help you with that. Just reach out to me through any of these methods, and we can talk more about that. Other than that, I just have some references here. If you are watching this on the recording, again, feel free to ask me any questions that you have through any of these methods. Contacting me, probably email or Instagram direct message, is going to be the best way to get in contact with me, and we can talk about it there. But for those of you who are viewing live, if you have any questions, now would be a great time. You can either put them in the chat box or in the question and answer feature. All right, I'm not seeing any questions right now, so I'll give it another minute here for those of you who are watching live. Feel free to ask now. If you don't want to ask now, or you want to ask me privately, feel free to reach out via email, like I said, Instagram, direct message. Don't know if you can direct message on TikTok, but I don't know how I would see that, so probably don't do that one. But other than that, I hope this was informative for you. If you enjoyed it, feel free to email me some feedback. If there's anything else you want to hear about, like I said, I am recommitting to doing these monthly. They're not all going to be hypermobility focused. I do have kind of other areas that I focus on as well, but there will probably be at least 2 to 3 more this year that are hypermobility focused. So if you have anything specific that you want to hear about, definitely let me know. So Nicole asked, do you think the Muldowney protocol is a good place to start? And I will answer that by showing you how accessible that I keep my Muldowney book here. I do think it is a good place to start. Definitely helps to develop some basic habits. However, I don't think it's possible to create a protocol that's going to work for everybody, or even really work for the majority of the population. But I do think it's a good place to start to develop some basics. And then to move on from there, you may need some personalized help. The one thing that I do disagree with a little bit is just the progression time. So it talks about taking somewhere around 6 months to a year to go through the entire protocol. And I'm just not sure that that's accurate for everybody. I would say, in fact, most of my patients are able to get through the exercises or the level of exercises that are covered in this book in a shorter period of time, and then progress to a little bit more strength training type exercise after that. Typically, a lot of the people I work with do have some athletic history or workout history, so it's not as though they're starting from scratch. If somebody had never really been active their entire life, it may take that amount of time. So I don't think necessarily that you have to go with the timeline. I would say of kind of going through things and trying to make sure you're leveling up every 2 weeks to so. Again, that's really hard to say if I don't know you. But I do think that yes, to answer your question, I do think it's a good place to start. A lot of the exercise I use are based off of that, and then just adapted a little bit. All right, so that's answered, and then I don't see any other questions. Hopefully, Nicole, that answered your question there. As far as other books for just information, Disjointed is pretty good. There are some things that I disagree with in that book, but it probably is something interesting to read and kind of take some of the information in there. I have also been doing some research. I'm not a registered dietitian by any means. I do work closely with some, but I do think that there can be some diet effects with hypermobility. So, regardless of other comorbidities like gastroparesis and things like that, but kind of focusing in on the diet can actually help not only with the hypermobility, but ability to build muscle and gain strength and things like that. So there are some great resources out there. I can't think of the name off the top of my head, but if that's something you're interested in, just feel free to shoot me an email and I'll definitely look that up for you. Other than that, if there's no other questions that anybody wants answered live, then it was great to share this with you guys, and I hope you enjoyed it as well. Like I said, feel free to give me feedback or anything specific that you want to hear about upcoming, and everybody that's registered will receive a recording of this webinar. So whether you attended live or you weren't able to make it, it's tough for me to keep track of all of that, and I know people's plans change. So everybody will get a recording of this one, and then you can also feel free to just respond to that email with any feedback or anything else you'd like to hear about. Hope you have a great night.